Have trust and verification of who these providers are. We need to understand what exactly their clinical privileges are so that we can quickly mobilize them to provide treatment to the people that need it in a short time frame. And this FRAC card and this authorization and credentialing process it seems to be the right solution to accomplish that.
Over time, the staff factor would begin to get fatigued. So we would begin to look for individuals who could come and help support and supplement our staff with the proper credentials.
A significant component of Pennsylvania's healthcare sector response is from the Medical Reserve Corps, doctors, nurses, and others who volunteer to respond when there is a major crisis.
They know that when a volunteer is credentialed and they're deployed somewhere, that they are really as pure as they could possibly be, that they are who they say they are, and they're capable of doing what they say and claim that they are capable of doing.
They recognize early on that we need to have some kind of method to credential these folks so that we understand who's there and what they're capable of doing.
We can actually in real time have a complete, accurate situational awareness of exactly where our healthcare providers are providing care in a real-time geospatial display, which is very important for us to make sure that our personnel are where they're supposed to be and doing what they're supposed to be doing.
Government agencies work closely with private sector suppliers, such as those who can provide mobile communications platforms. This bus and trailer system not only provides emergency services communications. In this demonstration at Arlington, responders who do not have interoperable credentials can be processed on the scene for a just-in-time FRAC credential. The responder is photographed and fingerprinted. The identity and professional qualifications are documented and checked with appropriate databases by satellite. Once everything's approved, the data, including the biometric information, is programmed into the FRAC credential computer chip. The responder selects a PIN number, the credential is processed and issued, then to be presented with the use of the PIN at the security perimeter ingress point.
Within the Pentagon, within our own agency, we have these we call them bricks, which are capable of reading the FRAC cards. And during an emergency, that's precisely what we would do. We would establish a perimeter, and at each of the ingress points, there would be one of these people or one of these folks assigned to that location with the FRAC readers, and that's exactly what they would do.
For the federal government is mandatory compliance. For state and local private sector volunteer communities, it's willful conformance. So if they elect to conform to the process, then they can follow the process of being interoperable with the federal government.
Also participating in the winter blast scenario is a group of 15 financial institutions in the National Capital Region, including Bank of America, SunTrust, and a group of credit unions, including Navy Federal.
In an emergency, financial institutions have pre-positioned to be able to bring in mobile branches, mobile ATMs, generators, supplies, to be able to truck in fuels to supply our facilities, as well as to deploy employees from other areas.
Winter Blast achieved its expected outcomes: education and outreach, familiarization and value added with the FIPS 201 standard, federal and mutual aid multi-jurisdictional interoperability, the 9/11 Act of 2007 H.R. 1 statutory requirements for credentialing and typing interoperability, near real-time geospatial display of human resource situational awareness, and post-event reconstruction for accountability, traceability, and liability.
The biggest thing we learned out of this today was a mutual learning environment between our state, local, and federal partners in this, across disciplines within the emergency response community, which is the fact that we all have the same problem. And the question becomes, at the federal level, as I just mentioned, we're leveraging HSPD 12 to make this happen. At the state and local level, there is not an HSPD 12. However, a lot of state and local governments are realizing they need to update their identification systems.
We've been impressed with the fact that it works so quickly, and that information can be transmitted over great distances so that a lot of people can keep track of what we're doing, who is at the scene, and how many folks are there.
It is a way for, as I mentioned, to make sure that we are sending the right people to the right places. And at the state level, I think it's very important that we are held to a standard of accountability.
The most important thing that we learned about this system is that it is a very basic and simple system to utilize. It does not require a tremendous amount of training or education for the security staff or the credentialing staff who utilize it.
In an emergency, we can quickly confirm a person's identity, confirm they have a proper credential, and get them assigned with a mentor within our facility to help assist our own staff to care for a greater number of patients.
Winter Blast was a huge success to show the interoperability between federal, state, local, private sector, and volunteer communities, and how we can truly leverage this capability to improve our business processes for response.
Mission Critical is brought to you by
Verizon Business Security Solutions, powered by CyberTrust, a global leader in providing authentication and validation services, giving first responders the power to respond. To learn more, visit verizonbusiness.com. When disasters strike, chaos ensues. Organize, respond, verify, and control access. With CoreStreet, we make credentials work. Microsoft delivers secure, interoperable technology solutions for the mission-critical business of government. If it's important to you, it's mission-critical to us. Please visit Microsoft.com/government.